station. This is Bobo FM.
The views and opinions expressed by the following program and its participants are solely their own opinions and do not represent the opinions of DMS Broadcasting and have no affiliation to the BBC.
At the Health Services Authority, we want to keep you informed about the latest developments that impact your health because your health matters to us. Join us each Friday and Saturday from 1 to 2 p.m. as we cover health news, offer advice, and answer your questions on Healthcare Today with HSA.
Do you have a healthcare question but not sure who to ask? Contact HSA's Patient Call Center to speak to one of our experienced clinical team members. We are here to answer your questions and help guide you through your healthcare journey. Need to make an appointment? Our team can help. Contact HSA at 949-8600 or email info@hsa.ky. At HSA, we are committed to caring for you.
All right, welcome to Bobo 103.1 FM. Dane hanging out with you back from vacation. Very excited to be back to you. HSA is one of my favorite segments to do, and really because the education behind it. Now, today it's going to be a very, very important educational piece, something I kind of feel like we need to discuss more in this country, but not only here in Cayman Islands, but around the world. And of course, our sister islands, Little Cayman and Cayman Brac, for those that are tuning in, welcome to the program. I am going to have the guests that are here in the studio introduce themselves. I do believe this is their first time being here in the studios with me, at least. Now, I know a few members of HSA have been here 3 to 4 or 5 or 6 times, but this is the first time I've seen them. But this show, I think this will probably be my 20th episode, ladies. So it's not been a lot of episodes for me like it was for my previous successor. But guys, I'm going to have you introduce yourself to our listening audience, and it can start off with anyone that wants to go in first.
Good morning, Dane. I think this might be my first time, and Liezel, but certainly I don't think will be our last. So thank you very much for having us. My name is Dymphna Carten, and I am a community psychiatric nurse at the Health Services Authority, having worked there for almost 3 decades. Wow. Very familiar with the community. In fact, the islands. So at the minute, I am working 2 days a week on Cayman Brac, and then my other 3 days here, temporarily filling in for the community psychiatric nurse who recently departed.
You have to love your job.
I do.
How long? You said you had 3 decades you've been there, right?
Almost 2 years off 3 decades.
Oh my goodness, that's so crazy. But
Yeah,
that's
great.
what I love about the staff at HSA. They all have expressed just how much they love the job, but it's mostly around not the brand and the name, which is part of it, but it's just the people they serve.
Absolutely.
Yeah,
and
it's incredible.
We get to serve, very much everybody and anybody, but very much a focus on the local community, and particularly on the sister islands, and I absolutely love that.
And you have a lot of patience too, right? Because it's required for the job.
A lot of, I didn't know if you meant patience by.
It can be either one.
Both.
It can be. Do you have them both? You obviously have patience over the time you've been there, but I like to say that the people that work in this field, usually it's very hard to budge them or get them annoyed or frustrated.
Well, it is hard and it's not, because if you love people and if you love stories and if you love to hear people's stories and you love to hear their trajectory through life and sometimes some of the challenges that they've faced, the things that have come up against and the successes that they have had. And there are amazing stories within our communities. So actually people think it's a really difficult job. It has its difficult moments. There's no two ways about it. But there's also a lot of joy in our work and happiness. And people think in mental health, how can that be? But let me tell you, there is. So
I love that. Love that. All right. And who else do we have here in the studio?
Hi, good morning, Dane. I'm Dr. Liezel Anguelova. I've been with HSA for a year now. I'm actually working at Faith Hospital on the Brac. So before that, I worked in Cayman, in Grand, for 4 years. So I'm not as well qualified in the community as my dear colleague Dymphna, but yes, I'm happy to be here, and thank you so much for having us. This is such an important topic to raise awareness about.
Very important topic, and I'm glad that you guys are here to discuss it. And you did say that you don't have as much as experience as your colleague, but you have enough. You've been in the field long enough,
yes,
right?
Now I've been a psychologist for now 26 years.
Oh, wow.
Yes.
You love it.
I love it. I love it. There's nothing else I would want to do.
What do you like? And I like to ask this question. I'm going to take it back to you too. What do you think is the most difficult part of your job?
I think actually working with suicide victims is probably one of the most difficult parts, because you're walking a very fine line, and you have to be extremely careful. Not that you don't have to be careful with other patients, but extremely careful. A lot of family involvement, a lot of support. I always say it takes a village to raise a child, and it also takes a village to help with mental health. It's never just on one practitioner. If we work in teams, we can help the village.
Yeah, absolutely. I love that. Really love that. How about you?
Of course, that is a really difficult question because I get to work in the community and I go into people's homes, I see how people are living. And, so a lot of practitioners, when people come to you, and particularly across the Cayman Islands, they make a real effort to come and see the practitioner. So they're well dressed up, scrubbed up, not a hair out of place. But you see, when you get to see behind the door, it can sometimes be a very difficult situation. So as a result of that, I get to see the challenges that sometimes people are facing. And those challenges can be, social, they can be housing, there can be people living in less than purposeful environments or living with others that are making their lives very difficult. We have an increasing problem with homelessness in the Cayman Islands.
Well, people are saying we don't.
Well, I think, we do. We do. Take it from someone who works in the community.
Yeah.
Yes, we do. And I am really, I'm very saddened by it.
Yeah.
And that's a group of people that, in respect to suicide, we need to do better because they're very vulnerable and very at risk. So I would say seeing the challenges that some people have to deal with on a daily basis is hard for me.
Thank you guys for expressing that. That's really important for me to get across first because even though I've always expressed that you guys do love your job, we have to show the difficult sides of it too. And hopefully we can dig in more into that as we speak more. And there's a very important question I want to ask at the end of this interview. If you guys are comfortable, you can answer it. All right, so the first thing we want to jump into leads us into our first question is Suicide Prevention Week. That's coming up. It's recognized globally. And why do you think, ladies, it's specifically here, why is it important here that it's marked here in the Cayman Islands?
Well, Dane, I think that suicide really is a global public health issue, but it's also very much a local concern for us here in the Cayman Islands. And every life lost to suicide deeply impacts not just one person, but their families, their workplaces, and their entire community systems. And by marking Suicide Prevention Week here in Cayman, we can raise awareness, we can break down stigma, which is still very relevant here in the Cayman Islands, and we can remind people that help is available and recovery is possible.
Yeah, I love that too, that what you mentioned, the stigma. Stigma is a big one. We're going to discuss that more as the interview proceeds, of course. Do you have anything else to add to that?
Yeah, I think that we've come a long way with, stigma. So you say you're going to address it more. But it's really important to discuss Suicide Prevention Week because the bottom line is that a lot of people don't know what resources there are available, right? So as I like to say, it's about cutting things off at the pass, right? So it's getting to the challenge before the challenge becomes too big and we lose someone. So that's why we're here today, to talk about the resources that we have at the Health Services Authority and to encourage people to seek help before it gets too late.
Yeah, so that it can be more a preventative approach than a curative approach.
Yeah. And I'll tell you why we need to talk about this more, which leads me to my next question. Is I was speaking to an individual that work in law enforcement, and they were telling me off the record, of course, without bringing out too much information to get them in trouble. But I think they weren't mentioning any names or anything, but they were saying you would not believe, Dane, how many individuals, how many young individuals I deal with on a daily basis that wants to take their lives, right? So let me ask this question. Globally, we know that this is something that's recognized globally. But suicide is one of the most leading causes of death among young people. Now, what I do want to ask is how do our local trends in Cayman compare to what we're seeing worldwide?
Okay. So what I can say to that is we don't actually have data on that per se, right? And when someone dies by suicide, it can take a lengthy process because it has to go through the coroner's office. And as a member of the Mental Health Commission, it is something that we are willing to address or actively looking to address, to reach out and to go back through history to see what the number of deaths by suicide has been in recent years. But what I can tell you is that having been around for a long time, I have met people who are now the same age as me, right? So in their 50s, who have lost parents by suicide. I have met people of that same age who have lost granduncles by suicide. I have met people who have lost siblings by suicide. And I've sadly met people who have lost children by suicide. What I will say is that, up until about 10 to 12 years ago, it was fairly rare in the Cayman Islands. As I say, it did happen. But unfortunately, and very sadly, it has become less rare in those recent times. So hopefully over time we will have more figures on that.
Yeah, I really hope we can pull some figures from that. Just to show them, well, you know what, I say I hope for that to happen, but I'm kind of hoping that we lessen those figures down a little bit more, right? But let me ask you this question, since you talked about data. Who do you think is affected more by suicide here in this country? For example, is it common more with men or women or certain age group? Can you answer that question?
Well, Dan, our local data shows that local data, we don't really have data from Cayman, but more of kind of, if I say local, would be US. It's more, men are more likely to die by suicide, while women are more likely to attempt it. And the reason why men are more frequently die by suicide is because they use more aggressive methods. They would, for instance, use a shooting, use a gun to end their lives, or, something quite aggressive, where women don't use such aggressive measures, so often they don't succeed in actually committing suicide or ending their life by suicide. Sorry, I should have said that. And then the highest rates are for middle-class men, and the youth are also very, very vulnerable. And for middle-class men, research says that mostly it's financial stress or work-related stress that causes for middle-aged men. And for the younger children, usually they're children that are impacted by adverse childhood experiences. And adverse childhood experiences are things like abuse, whether it be verbal, sexual, physical, neglect, and then household dysfunction. And for household dysfunction, we're talking often about domestic violence, substance misuse issues of the parents, and then of course mental illness in the family, and or family splitting up. So those are the dangers for the youth.
So sad to even hear some of the things that you brought up. It really spoke loudly to me. It's just like middle-class men. That's one of the words that stood out. Also, their jobs and just different factors or finance, especially now in the society that we live in. I hear more and more men talking about, Dane, I make $2 to spend $5.
Yeah.
And now you hear more of these conversations every day.
True.
You kind of feel like, should I be asking them if they're okay also? Because they speak about this so often.
Yes.
So I think the question I want to ask is what's one of the things that, and this is and feel free if you don't have the answer for it, ladies, because I know that I don't want to go all over the place too much with this conversation, but I'm just very intrigued by it. But what I do want to ask to you that I think it's very important is do you find that men are most likely to attempt suicide? Is it because they don't talk enough?
Exactly.
More women are open with their feelings, but men are not.
Yeah. And they feel more comfortable. Women feel more comfortable talking about it, right?
Yeah.
As women, it's something that we do. We've done it from an early age. We talk about our issues. We talk about complaints. We talk about things that niggle us. When things get bigger, we talk about those as well. Men tend to be a bit more insular. Right, exactly. A bit more closed off, a bit prouder, feeling that, it's not very macho if I start to talk about my feelings and my fears and any anxieties. But what I will say, Dane, and I think this is a positive thing and it is a shift is that I do feel that men are starting to open up more
Yes.
and talk about their mental health.
good.
And I've seen that with friends, I've seen it with family members, I've seen it in general conversations, because this is something that affects everybody, right? It's not you or me. It's not us or them. It's you and me.
Yeah.
It can affect all of us. So yes, so I think the more that we get men to talk about it, and particularly when we have, well-known figures in the community like Dane Ramoon,
Yeah.
who's open to talking about his feelings
Absolutely.
and encouraging that you can represent that, because we need champions,
Yeah.
right? We need people to talk about lived experiences,
Yes,
and that will
yes.
help.
And I think there's also the very traditional role still, cowboys don't cry.
Yeah, yeah.
And, men are not allowed to cry, which
Yeah.
I have so much empathy for men because of that, because help is available, but you have to be open, to go and find it, or to be receptive
Yeah.
for the help. So yes, if I can leave one thing, I hope that a lot of men hear us today and say, please guys, you don't have to be cowboys.
Yeah, and just recently, I'm so glad you brought that up, because so I have 3 kids, a daughter who I love dearly, and same thing for my boys. And I found out you never really get a manual book on how to raise your kids. So every day you're learning, but you've got to be open to learn, right? And especially from your kids. And I just remember one day, because I've been teaching my boys so much, don't make people see you cry. Don't let it out. I was always saying that for some reason, but it felt off every time I said it. But it was taught from my parents, my dad specifically. So I was like, I got to keep this tradition going. But it wasn't until one day I said, no, it doesn't feel right. It doesn't feel right, because my youngest asked me. He said, Dad, why? Why am I not allowed to let it out? And I said, you know what? You're right. I said, stop the whole. I don't want you to man up anymore. I want you to man down.
Yes.
I need you to have that moment to man down. It's okay to let your guard down. It's okay to let those tears out. I even explain it to him, because you got to get to their level sometimes.
Yes.
It's you're releasing the bad vibes from you. You're taking all the tears that's coming out. It's the bad energy that's
Yes.
being released. And I felt so good having that conversation with him, because they feel lighter.
Yes.
Exactly.
They feel so much lighter. So
That's wonderful.
I'm so glad that you guys mentioned that about the cowboy mentality of how we raise our kids, right?
Just on a humorous story. So my first nephew is getting married in a week's time, right, in Northern Ireland.
Congrats.
And when he was 2.5 years old, so we come from a farming background, and this just shows how he was being brought up and reared, or what he was just seeing, right?
Yeah.
This, macho way of living. So we're walking in the lane to the old house, and there's, some sheep or something coming down. So my father is there, his own father and his uncle. He was clenching my hand really tightly, enjoying holding his old aunt's hand. And as soon as he saw his father and his grandfather and his uncle, he couldn't get the hand away from me quick enough, released the hand, got one hand into one pocket, but couldn't get the other hand in, and put it on the outside of his pocket, and continued to walk up the lane with this hand, because he felt that, and I was really humoured by it, but I thought, isn't that interesting? At 2.5 years old,
He already knows that.
Yes.
Typical male
Yeah.
behavior.
It's happening more than you can
so how
realize.
are we supposed to talk about our feelings if that's what you're
Yes.
feeling
Yeah.
and you're growing with as a 2.5-year-old?
Yeah, we got to be careful.
Yeah.
We need more advocates. We need more men just talking to other men, letting them know how it's okay to be sensitive. It's okay to release it. It's okay to talk. I like this. I really do like this. And this is a very important question, because you guys talked about this earlier. And I think this is for both of you guys, ladies. So what are the most common factors for suicide that you're seeing amongst patients here in our country, our community, and our island?
Okay. Well, the main risk factors we see include untreated mental health conditions such as depression, alcohol or substance abuse, psychotic disorders like schizophrenia, maybe bipolar, mood disorders, of course, relationship breakdowns, right? And social isolation. But I want to add to that too, that homelessness is a growing problem, and definitely a factor what we must consider when we're looking at reasons why someone might want to end their life, because they already feel that they're purposeless, they're hopeless. Where are they going to go? It's just Groundhog Day, day after day, and until you can get a job and get on, get that money flowing, it's very difficult. And there are
Yeah.
many people, and homelessness isn't just about people living on the benches by the beach. They're also sofa surfing. They're living in cars. They're living in houses that have no electricity, no running water. I mean, how can you feel safe and positive in your mental health, in your emotional state, if that's how you have to live on a day-to-day basis, and then because of how people may look at you and address you?
Yeah.
So these are some of the factors that we need to seriously address. You know, and again, it goes back to, you know, the stigma of, you know, what is leading people to live lives such as that, right?
Yeah.
Or even sometimes, you know, being involved in crime, right? What
Yes.
is the underlying cause of that? Unfortunately, we do have, you know, our courts, right? Our treatment courts, and one of them is mental health court, and that is showing, you know, great success in helping manage people, get people into treatment through the Health Services Authority, and get them back on track and see them well and live more purposefully and reduce those feelings that they have nothing to live for.
Yeah. Thank you so much for expressing that. So important. You wanted to add? Sorry.
I just wanted to say, you know, in terms of risk factors, there are individual risk factors which are individual to each person. And Dymphna went into that. She spoke about the mental health challenges. People that have previous suicide attempts, the risk is very high there. And then people that are battling with coping skills, problem-solving skills, conflict management, you know, so those things are also important in terms of individual. And then there are relationship factors, like negative relationships that children experience, but we also experience at work, like racism, bullying, violence, social isolation, those kind of relationship things, negative life events like loss. You know, sometimes we have little children and their pets pass away, and for us as adults, sometimes it's not such a big deal, you know. But for the little children, it's an absolute big deal.
Hard,
you know, it's a huge loss. It's a little part of their whole system. And then community factors. For instance, if the family has a traumatic history, like there's lots of trauma in the family, and it's never been discussed and never been opened up, never been helped. And you also get families with suicide clusters. So there's been multiple suicide attempts or suicides in the family. Those families are specifically at risk in our communities. And then high-risk environment where there's high conflict levels. That's also very important. And then people that have disconnected from society, you know, that live very isolated and very alienated, those people are also more at risk. And then some environmental factors is negative stereotypes about suicide and about seeking help, you know. And again, that comes to the stigma that we're talking about. And then unsafe media portrayals, like the children are so much on social media now.
Very much so, yeah.
And their whole images, their whole identities are built sometimes on the social media. That's not a very safe foundation to build an identity on. And then reduced access to lethal means of suicide. You know, for instance, if there are no guns around, or if you remove the access to lethal means, that you know, a risk factor is having lethal means, and removing it would be a protective factor.
Yeah, there's just thank you so much for those points, and also some things, guys. By the way, I am no expert here, right? I just hear certain things and it triggers me to just make mention, and seeing that we have experts here, they can either say to me, you know what, Dane, yeah, you're absolutely right, but I'll look at it this way. There's things that we have to stop saying to our kids, like, in my humble opinion, is stop making them, because this happens more in the Caribbean, you don't have the same problems as me. That to me is so bad to look at it. Like, obviously we're adulting. I get it. We're living an adult life, but our kids, because you mentioned social media, so automatically is a trigger to me. They're living a completely different life than we live.
Absolutely.
Completely. So we got to stop telling our kids that, what do you have to worry about? That is just hearing it come out of my mouth, it just sounds so damaging. So let's just be careful with that, and hopefully we can talk and have more of those conversations. Guys, we're going to take a quick commercial break. This has been such a blessing to have you guys here and having this conversation. For those that are listening and are tuning in and you're just joining us for the first time, don't worry. We'll be right back. We'll do a reintroduction again. And if you have any questions, you know how you can reach us on the Bobo Instagram page. It's Bobo103.1. Please send the questions off. We will get them to our guests, and they'll be happy to answer those questions just in case anything was missed. We'll be right back.
The Health Services Authority has over 120 world-class physicians offering the most comprehensive range of specialist services on island. Our dedicated team of professionals provide the highest quality care in orthopedics, interventional radiology, women's health, geriatrics, and a host of other specialist areas. We are a JCI accredited organization with a proven record of excellence. At HSA, we are committed to caring for you. For more information, visit hsa.ky.
All right, we are back. Welcome to Bobo 103.1 FM. Thank you so much for being a part of the show today with us. And this is all brought to you by HSA. We're going to have the guests reintroduce themselves just really quick, just in case you're a new listener and you're wondering what the conversation is about. Let's have them reintroduce themselves. Go ahead, ladies.
Hi, this is Dymphna Carten. I'm a community psychiatric nurse at Health Services Authority, and we are here today to talk about suicide prevention.
Hi, I'm Dr. Liezel Anguelova. I'm the clinical psychologist at Faith Hospital on the BRAC.
Ladies, thank you so much for being here. Now, mental health conditions such as depression and anxiety are often linked to suicide, unfortunately. How significant is this link in a local context?
Dan, it's actually very significant because worldwide, approximately 90% of individuals who die by suicide have an underlying mental health condition. But however, not every person who dies from suicide has a mental health condition. This is also important to note. Locally, we see that depression, anxiety, and substance abuse are often present in those that are at risk. But the good news is these conditions are treatable and early intervention can save lives. And we at HSA are there to do that.
Yeah, thank you so much for addressing that. Is there anything else you want to add to that, or do you think that was
I think
fair
it's
enough?
A great answer,
Yeah.
Lisa. I just want to point out, too, that sometimes we think that the only mental health condition that can attribute to someone taking their life is depression. But we also have to be mindful, too, of people who may be diagnosed with schizophrenia, right, a psychotic disorder, or who may be bipolar. And sometimes, if they're hearing voices, the voices actively might be telling them that the best thing for them to do is to end their life. Yeah. And if they have limited control over those voices and a lack of insight, they can make that decision. And also to bear in mind sometimes too, when people who have a bipolar disorder, that if they're at the height of that, so that when they're in a manic phase, they might do things that are very reckless that might lead to them, dying by suicide, right? But equally at the other end of the pole, when they become very low and they can't cope with living in this way, right? It can be very difficult, that they might think the best way forward is to die by suicide.
Yeah. Listen,
and often
seeing that you mentioned that, all right, let's talk about this now, the barriers, cultural attitude and community specifically here. What do you think, and I want to ask this so that way the listeners understand, why do you think it's hard for individuals here to seek help based off of their attitudes here, cultural-wise and so on?
Well, I would say that historically, it's been very difficult for people in Cayman to seek help because we are a very small community. And certainly when I came here many years ago, we were even smaller. So, people were very private, they're very proud. They had been a resilient people from day dot, actually, because they had to. So when you grow that mentality, you always think that you have to be strong, that you have to get on with it, and you have to make the best of what you've got. Right? So they've been very proud and very private about that. But fortunately, I have seen a tremendous change in that over the years. A tremendous change because resources and healthcare, particularly through the Health Services Authority, has grown. So one of the things that was done, when I first came here, was to really make sure that we had a team of specialist nurses in the community. And that was the community psychiatric nurses, because we recognised that not everybody wanted to go and see the one psychiatrist at the time who unfortunately, sometimes had a bad reputation because he was the only one and he was poorly supported. He didn't have a network of people. But by having community psychiatric nurses in the community, it meant that the general practitioner could refer you. If there was a social worker involved, they could refer you. If there was a neighbour involved, they could refer you. Anybody and everybody could refer you. You could say, look, would you consider seeing, the psychiatric nurse? Would, be okay? She can go to you. And, fortunately, we don't wear uniforms, right? So we work in normal clothes. And for the most part, we didn't drive cars that said mental health on them. So for many years in one of the outer districts, they used to think that I was Becky from planning. Yeah. So I was quite happy being Becky from planning because it enabled my patients to feel comfortable with me turning up on their door. But what the great thing about that service is, and this is very important, is that, because of stigma, you don't always have to see the psychiatrist or the psychologist, right? You can see the community psychiatric nurse. And we are there, and we can see you in a clinic, or we can see you in your home. I have also done consultations on the beach, right? I've been to see people, on a cabana. Wow. I've actually seen someone by someone's grave once because that's where they had lost someone. That's where they feel comfortable. Or it can be in a coffee shop. So we are very fortunate as community psychiatric nurses that we work in an unconventional way. Yeah. And that enables us to build these relationships and to assess people and to manage. But the stigma is real. But now with a team of, several psychiatrists, several psychologists, community psychiatric nurse, therapy assistants, occupational therapists, we have a broad range of people that are very able and well equipped at addressing your individual needs and taking that service to you if you need the help.
I love it. I love it.
Dane, I also think that some of our talk discourages people for seeking help, Often we hear people saying, you're too sensitive, or snap out of it, or just toughen it out, I've even heard people say, don't tell anyone our family business. We have to just keep it in the family, And then often people, feel too ashamed to go and seek help. But actually, suicide prevention is the strongest when we're talking openly about it, when we don't have shame and we encourage one another to get support when needed.
Yeah, I think that answers the question that I was going to ask, and I'm glad that you mentioned that, which was, the stigma, the silence around mental health. We got to be very careful because I grew up in that environment, happy to talk about it now because it breaks that silence and comes out of the dark. But, at one point in my life, I felt like I was heavy into depression. And I always remember family members saying, don't discuss this with anybody else. Don't talk about this, And I think that was a barrier because I needed to talk.
Absolutely. And I think too, Dane, because there wasn't the treatment going back 30 plus years ago, right? And there wasn't the resources. Unfortunately, some people who were quite unwell become even more unwell, right? And therefore, people in the community would look at them and they would see the worst case scenario. They wouldn't understand that actually with treatment, you can get better. So nowadays, it's 1 in 4 people, that is the statistic, will at some point suffer from some sort of mental health condition in their life. Does that mean to say it's long-standing? It may be. But with treatment and with insight, you can live a very purposeful and happy life, and no one needs to know. So I know people who, have long-standing diagnosis of mental health illnesses, but they're very well. They're never hospitalized, and they make good recoveries. Sometimes people make good recoveries, or sometimes you're constantly in recovery because you're on meds, you're getting that support. But the important thing is that years ago, people didn't see the hope. They didn't believe that there was a possibility of change or better days. Today, there is. And with support, with medication and the right treatment, you can live a very happy, purposeful life.
Happy to hear that.
And research also says that if you're working towards a positive outcome in terms of suicidal behavior, the reaction of the first person that you divulge to, that I'm not feeling well, or I'm not okay, or I'm feeling suicidal, determines whether it's going to be a positive outcome or not. So if somebody mentions, I'm feeling like I want to take my life, don't ever take take it for granted. Do something about it. Whether it's a cry for help or whether it's real, always treat it as real.
I love that. Ladies, I think an important question to ask after that conversation is, if someone is feeling suicidal, what do you think the steps they should be taking?
Well, I would say the very first step to take is do not be afraid to ask them if they are having thoughts of ending their life or if they feel suicidal. And this is not planting the seed in their head. You're not encouraging them to think more about the intent or the options. You're simply exploring that. You're giving them an opportunity to talk, and you're going to be able to access help. So please, as Liezel said earlier, the very first person that they share those thoughts with, can have a very positive, outcome if they're, addressed properly, and they don't feel frightened, they don't feel shame, and they don't feel that it's something that can be pushed away. So please ask, are you thinking of ending your life? Do you think that the world would be better off without you? And, delve into that a little bit further. I'll let Liezel speak to that more.
Okay. Dane, there's so many things I want to say, but let's start off with, if someone's in immediate danger, the best thing to do, or the thing you should do, is call 911 straight away, or go to the accident and emergency department at the HSA. And for those struggling, but they're not in immediate crisis, reaching out to the GPs, HSA Behavioural Health Clinic, or Alex's Place for the children and the teens. That's a very good first step. But the key is not to stay silent. Speak to someone you trust and seek professional help. Yeah,
and you answered both of those questions that we were going to ask just a couple minutes ago. So it's really about and I'll make sure I touch on it one more time just so the listeners understand. So in crisis situations, you just gave a number they should reach out to at HSA that you can provide. And also for those in immediate crisis, what routine mental health services are available through HSA?
Well, the routine mental health services are the outpatient behavioural clinic at Smith Road. And if they want to call there's psychiatrists there. There's also psychiatrists on call out of ours as well. But there are psychologists there. There are community psychiatric nurses that you can be put in touch with, right? That can reach out to you, set up an urgent appointment to see you, to address how you're feeling, and to enable you to get the help you need. So that's really important. And if it's outside of ours, as I say, there is a psychiatrist on call, and if they do present to the ER department at the Health Services Authority, they will be seen by the psychiatrist on call.
Love that. And I know this is you wanted to add anything else? Sorry.
No, I'm good.
No, it's good? Okay. This is a very important one to touch on, because a lot of families do not, like we stated before, get professionals involved because one, they're embarrassed or they don't know what to expect. So what can families expect if a loved one is brought in for care? What is the expectation? Open the doors up for us, for those that are listening. What am I going to see if I unfortunately ever have to face this?
Well, I think the first thing as a psychologist that I would do is try to build rapport with the person. Then I would do a suicide risk assessment, which I would identify risk and protective factors. And then do the suicide inquiry, which was Nurse Dymphna was speaking about. And this is basically where you explore the person's suicidal thoughts. Are there plans? Was there previous behavior? What methods have they got? So to just ascertain how far the plan in their head has been formulated. And then you'll know at which space this person is. And then determining the risk level and interventions that can help. And then also we do what we call a safety plan with patients. So we first look at what their immediate response can be. For instance, like, do you have some coping skills that you can use on your own first? And who are the people that I can contact if you contact me and you're telling me that I'm at risk here? And then including in the safety plan resources, like for instance the numbers for Alex's Place, the Behavioural Health Outpatient Clinic. All those things are then included in our safety plans that we draw up.
I love that. All right. This one is a very important one to ask, because I truly believe there's more that can be done in this country to talk about topics like this, but to also help, not only as a community, but let's talk about the schools, let's talk about the churches, let's talk about the workplaces, because these places that I just mentioned, these institutions, I don't want to use the word lack resources. I don't want to use that because I feel like I'm speaking from an ignorant standpoint, because I haven't been to every school. I haven't been to every workplace. So I can't tell who's actively serving in this area. But I think the most important thing, and I'll be off this service if I never mention this, if they're not doing it, how can they help? How can they be involved? And what role can they play in suicide prevention in Cayman? I think that's a very important, because, for instance, it's no secret, I do attend church here on the island. Very much in touch with my faith. But I think one of the topics that I see lacking in churches today is this conversation.
Yes.
For some reason, I kind of feel like, if you're a person of faith, the number one thing we see in the Bible a lot of the times is that we're supposed to help anybody that's going through any crisis, or what's the word that's constantly used? It's not ringing to me right now, but I know this is one of those things that we run to the rescue of the people that are suffering, right? So I'll use that for now. But what's your thoughts? What's your feedback on this, ladies?
It's quite a broad question, but I'm going to start in one place. So I think community organizations are very crucial. So in schools, we can teach resilience, we can teach coping skills. And I know often the teachers are already overwhelmed by the general curriculum, but if we can include some of those in the curriculum, that would be a very good start. Specifically if we're looking at preventative rather than curative measures. In workplaces, they can create mental health friendly environments. They can also have employee assistance programs which are guided by psychologists or psychiatrists, and to manage the workplace stresses. And then churches and community groups can provide safe spaces for conversations and support. I think that, one of the protective or risk factors is actually objection to suicide because of a belief system. Very often, I hear from my patients that they say, no, I'm not going to, when I die, I will, not be going to heaven. And that is actually good, because it would prevent them. Doesn't mean the person is not at risk, but it's good that they have a resource that they can hold on to. Yes, so I think prevention works best when the whole community is involved.
Absolutely. Absolutely. Anything else to add on that subject matter, or do you think that was definitely well articulated? I think Liezel did a really good
job in covering, but I would like to say that in terms of maybe some of the church groups, there could be greater understanding of perhaps some of the attitudes towards particular groups in the community, and in particular the LGBTQ community, who can sometimes suffer very badly because of the way they are treated. And I know that I have had over my career dealt with people who have felt very misaligned, very judged, very wronged, and it has led them to do things that really put their lives at risk. So I would ask for greater understanding there. But in terms of, if there is anybody out there and that they're struggling with perhaps their sexuality, and that they feel they need support, they need guidance, again, I would ask you please to consider reaching out to the Behavioural Health Outpatient Department at the hospital, whether it be the adult section at Smith Road or the Alex's Place at the hospital, because that's what we're there for. We're there to address all issues that may impact or are impacting your mental health, and see how you can better live life with those.
Absolutely. And I'm glad that you touched on that too, because like I said, I always try to be very sensitive to how I express my faith. But what I do want to say is you touched on something, once again, very important when it comes to, of course, anybody that might feel isolated because of their sexual choices or what they decided that they wanted to do. And I always say to people, we are on even playing field here. Whatever you feel, the word that is thrown around constantly, whatever you feel that they're sinning with, take a look in the mirror, right?
Absolutely.
It's even playing field.
Yes,
even
I
playing
love
field.
that.
Yeah.
But there is also a lot of churches who are very supportive.
Yeah.
And I know that, and it sincerely impresses me, and I'm grateful for it.
Absolutely.
And also, as Liezel said, it can be a tremendous protective factor, because, I know someone who, due to their illness, which they were diagnosed with schizophrenia many, many years ago. And often those voices would tell them to kill themselves or kill the family members that they were with at the time. But because they had such strong faith in God and belief that it was a sin to take their life, it stopped them from harming themselves or others.
Wow.
So there's a place for everything.
Yeah.
We just need to know how we can, fit it all in and work together in a cohesive, caring way.
Absolutely. When we come back, we're going to talk about hope and prevention, and we are going to be wrapping things up. Thank you so much for keeping it locked here at Bobo 103.1 with our HSA team.
Health Services Authority is now offering online payment options for patients. Patients of HSA can now pay their bills, including deposits, towards scheduled services online at payments.hsa.ky. The secure, new online payment system accepts debit or credit cards and is in addition to the available payment options of cash, check, and online bank transfer. For quick, easy, and secure payment directly from your phone or computer, visit HSA's new online payment system at payments.hsa.ky.
And we are back. Welcome to Bobo 103.1 FM. Dane hanging out with you here. Don't forget our social media is up if you want to ask any questions around the conversation today on suicide prevention. We had a wonderful conversation, and I hope we have more topics like this on the show moving forward. Right now, before we left, we talked about hope and prevention, and we want to jump into one of the questions. What are some of the warning signs that friends and family should watch out for when they're concerned that someone may be at risk for suicide?
Okay, thank you, Dean. That's really important. So warning signs can include talking about feeling hopeless or wanting to die, feeling that, that their family, that their friends, that the world would be a better place if they weren't in it, that they had nothing to live for, that they felt purposeless. What is the point of all of this, right? Feeling very flat. Withdrawing from others, so socially isolating, not taking calls, not taking care of themselves in the way in which they would normally, okay? It might be sudden changes in mood or behaviour. And some of those sudden changes in mood and behaviour can sometimes even be what you might feel is an improvement in their way of being, right? Because sometimes that can indicate that someone has made a decision that they are going to die, that they are going to take their life, and that they're feeling more comfortable, that they've got the energy to do it. So don't necessarily see it as a positive thing. We have to be very careful about that, right? Yeah. We also, people giving away personal belongings or talking about their will, or even maybe putting together a will, right? Throwing things away, or sometimes engaging in risky or reckless behaviour. Going out and driving recklessly, speeding, things that are very out of the normal for that individual, perhaps being, an increase in the use of alcohol or illicit drugs, or even trying drugs when they've never done drugs in their life before. Just living life in a way that they don't care. Taking chances that are dangerous, right? So if you see some of these signs, you might want to take them seriously.
Thank you so much for educating us on that too. I really appreciate that. Leading us to our next question is research shows that hope and connection are protective factors. How important is it for people to feel supported and connected?
Dane, I think hope and connection are one of the most powerful protective factors that we can have, because staying connected means that you are not isolated and you're not alienated from others. So there are people in your environment, and that gives hope often to people. And then feeling like you belong, that there's somebody that cares for you, there's somebody that wants to be there for you, somebody that's got your back. This could often very much help in terms of preventing a crisis from escalating. And I think in a small community like we have in Cayman, we have a real opportunity to look out for each other, because it's small, and definitely if people are just willing to open up, there is help and hope.
Yeah. I like the hope factor is, let's continue. Just a small piece of information for me. Let's continue to spread hope to as much people as possible. We go around with this word Cayman kind, and we spread it across the entire island. But I think at some point we got to be careful that we're not losing it, because I've heard so many people talk about suicide and just their mentality around it shows that we still have a lot of work to do. I remember somebody making a statement, basically taking hope from somebody else by saying when the person said, sometimes like they got tired of them saying it, so they're like, I just want to end my life, and they said, well, just go ahead.
Yeah.
I think that's the worst thing that you can say to somebody that's feeling that way. Yeah.
You have. It's very important to at least just have empathy.
Yeah.
Just at least to say, "Gosh, I'm sorry to hear that. When did that start happening? When did you start having these thoughts? And
even to say, what do you really mean by that?
Yeah.
Can you tell me what that looks like to you?
So important.
Because I need to understand that, and I'm not understanding that. So tell me what you're telling me.
Yeah.
Does that mean that you're making plans? Do you have intentions? Do you have means? Do you have a time frame on this? What is it that makes you feel that way?
Yeah.
Right? What can we do to help you? How can we help?
So good. So good. Ladies, it's been fantastic having you in the studios, and I think this was a conversation that was very much needed to have, and I'm pretty sure our listeners feel the same way too. I've given them the outlet in order for them to ask questions, just in case they have any more questions for you ladies, and I'm pretty sure you'll be happy to answer it back. And then you guys, I mentioned it, our social media, Bobo 103.1 FM is the social media line that you can use to get in contact with them. But my final question is, just in case, unless they have something else to add, but my final question is that what is the message of hope and encouragement you would like to leave with our listeners today?
I think, Dane, that everybody should know that suicide is preventable and help is available. And if you're struggling, please know you're not alone. Reach out to a loved one, reach out to your doctor, reach out to the HSA. Recovery is possible and your life matters. I always use 3 S's for my patients, and I always say, please stay connected, start the conversation, seek help and support.
Love that. Love that.
And I would just add that, every conversation, no matter how small, contributes to a more supportive and caring and understanding society. And we have to be caring, we have to be kind and understanding. And one of the things that I would also like people to do, and for the public, is to be sensitive to families who may have lost ones to suicide. And don't talk about committing suicide. Suicide was decriminalised in the Cayman Islands in 2020 for good reason. Unfortunately, there's still 23 countries across the world where people can be presented to the courts, charged, arrested, either for attempting to end their life or ending their life. And then, of course, that makes the problem even greater for them, for the family. But, to be sensitive to that and, not to use terms like successful, completed, committed. Someone died by suicide, but ultimately it's something that we would love not to hear in the Cayman Islands. So please, I hope that you've all enjoyed listening to this today. I know also that, Dane, you'll probably put up some resources that are available across the community that, because there's a number of helplines that are out there as well. So thank you for the opportunity, and take care, everyone.
Thank you. Thank you so much, ladies. And I hope to see you again. This is not a conversation we want to have once. This is definitely a multiple amount of times that we would love to discuss this. So hopefully I see you guys in the future again. Thank you. Have a wonderful day.